Hello and welcome to the latest episode of the Melbourne Athletic Development Podcast. Today we have a bit of a special podcast because Jack and I are not in the same room for the first time. Uh,
Does that suit you,
Jack,
John?
I think it suits both of us, doesn't it?
No, indeed, we're on different sides of the world at the moment.
Um, we thought it would be a really good opportunity for us to discuss travel and some of the things we've been exploring because, as some of you may know who follow uh, what we do in our clinic and the education things that we do. A big part of what we are very interested to do is seek out new information and experiences so that we can enhance our practice. And recently, Jack spent another 2 to 3 weeks over in Italy. It's the second time he's been there this year at the University of Padova. And he'll be going back in September again. And I'm currently actually in Italy as well. I'm in Milan with track and field group associated with Melbourne Athletic Development as we navigate some European competitions. So we thought it would be a good way to do a bit of an update and talk about some of those experiences and why we actually think it's really important to go venturing outside of Australia and even Melbourne in particular to try and seek out new information and new experiences. Jack, what based on that, what did you get from this latest trip, and what made you actually want to commit yourself to doing a few years of these back and forth trips?
Well, because the stuff I'm learning about essentially doesn't exist in Australia at this point.
Mm,
The only person who teaches the fascial manipulation work I'm doing, she's an Australian who lives in Italy. When she comes back to visit her family, she'll teach it once a year. But I think one of the key things I'm learning through this process is there's a lot of theoretical content. All the theories online with like pre-recorded lectures, or we do some live lectures as well. And it's always useful to understand the theory and help to develop some of those conceptual models in your head about the assessment and treatment and the underlying science behind it. It's another thing to actually do it. And that's always been the biggest thing for me since starting this course, but even like before when I'd done some of the short courses, is it's always interesting to think about the theory and it always seems logical in your head. It's another thing to how that transitions into what you do clinically. And like particularly with
I
this
th
particular,
yeah,
you go on.
as the saying goes, like you can't buy experience, and I think
Yeah.
that that's something that unfortunately it seems like because things are accessible in general to people now, particularly as you said through the online platforms, people feel like they've got more understanding of something than maybe they do, and particularly in an area like healthcare, where there are actually practical and physical skills that are associated with carrying out interventions. You actually need exposure to them and you need to
Mm.
practice them and you need to feel them and you need to see them because that kinesthetic development is not straightforward. It takes a lot of time.
Yeah, look, absolutely. And I think there's a few things to it because you can learn a particular method, and that could be a particular skill set in exercise. It can be a particular skill set in like hands-on palpation or assessment or treatment. But there's two things to it, and one of it is understanding how to actually do it, and particularly like we say the fascial manipulation, very much it's hands-on with the assessment, and that itself is something that really isn't valued, I think, particularly in Australia, what we can actually assess and
Well,
feel with our hands.
sorry to interrupt you, but I think that that was the most important and interesting thing about our discussion with Antonio Stecco.
Mm.
Like he really brought forward the reason that and I'm sure he's right, he's the one, him and his family are the ones that have been doing this research. But the reason we're not getting greater improvement in application or utilization of manual therapy research is typically because the methodology that people use to assess the application of it is not there.
Mm.
And they've gone through a very long and arduous process to strongly develop the assessment model that matches the intervention model that they use. And as you said, like it's become really clear that if you assess the right things, or at least the things that are associated with the intervention that you're doing, it's actually not hard to prove or disprove whether the manual therapy technique that you're using works or does not work. And I think that that's the big issue that we have with a lot of other manual therapy research. They go, oh, we applied this quite, non-specific, non-well prescribed, doesn't have a good understanding of, the intensity, the duration, frequency of the treatment. Plus, we didn't really like it was just a general assessment of like, oh, we think that they have increased tone in this. They were very
Yeah.
specific. It's like you need to assess it along this, 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 this. If you find this, this, you apply these things with this prescription. And if that was the case, you could very easily show it either worked or it didn't work. And
Mm.
that made it a lot more clear. And it obviously seems it's like, that is a clinical trial. That is how you actually apply it. You need to control for the variables that you're measuring. But I
Mm.
reckon that was the thing out of that that showed these guys are serious. They want to be able to give people a tool that means that they can assess this area with some level of clarity, and then they can actually apply an intervention that is specific to that, what they found, and then they can assess whether that actually was effective or not.
Yeah, and I was just going to emphasize a point here with, I think, again, with thinking of assessment, particularly hands on assessment. I think of, say, SIJ and SIJ mechanics, where a lot of people will be very quick to say, you can't assess SIJ mechanics. And interestingly, there are studies like that, but with those studies, they have practitioners who don't have experience in actual assessment, where like they're taught it and then they see if there's good inter-rater reliability and there's not. There's also studies though where they've shown experienced practitioners who have knowledge and have refined their skills to be able to assess, say, SIJ mechanics, demonstrates good inter-rater reliability. And it's interesting, each time we go to Italy, we've been doing inter-rater reliability testing between all the practitioners doing the course. And not surprisingly, because there's a bit of a mix in terms of some people doing the 3 year program have done some of the short courses before and are familiar with the method. Some people have never done it before. So, to no surprise, if you put a group of people who've got some experience in it, the inter-rater reliability is better compared to those who don't. And then if you compare the assessment we did in May compared to when we did in January, we're seeing an improvement. And they're actually going to do that each time we go because they realize that it's one thing to be able to even describe where you do how you do the assessment, what parts of the body you assess, and even describing, say, the anatomy. But it's another thing to actually be able to then use that in terms of what you palpate and what you actually feel. So it's interesting because I remember even actually talking to you about it, and even I thought of myself of like 3 years seems like a really long time to really develop and refine your skills in a particular method, which I agree. And obviously, it's not a cheap process going to Australia to Europe 3 times a year. But interestingly, I'm starting to actually really appreciate how they've structured the course because you actually need that time between those weekly intensive practicals to go away, actually start to apply what you learn, realize that you also then make mistakes. And when you go back, you start to realize some of the mistakes that you make, but then continue to refine the process. And it's something that I
Mm.
think also, too, like it's some of the limitations you can start to appreciate with how a lot of education is done these days, because a lot of education is, like you mentioned, online, or it's like a 1 day course where you have one interaction with someone, you leave, and you never see or speak to them again. And that to me doesn't really transfer to being able to adopt that skill set and integrate into what you do clinically. And I'm definitely experiencing that firsthand myself.
Yeah, I think that that's, at a broader level, it's that idea that we spoke about at the start of like, you've got to put yourself in the environment, whether
Mm.
it's, as you're mentioning, with a patient working on a particular problem and trying to see whether you can, navigate the assessment and intervention and see what happens over time. Um, you actually have to put yourself in those environments.
Mm.
There's too many armchair experts who, because they maybe have theoretical knowledge, end up in a position where they think they understand something, but until you're actually in that environment, you don't really know how you're going to play out the situation. And I think particularly for younger practitioners, I know that our advice would definitely be like just get involved
Mm.
and actually try things and be in those environments. If you want to work, whether it's in neurological physio. Like, don't just read books about it. Go and actually work in an environment where, what they do is neurological physio. If it's in
Mm.
a sporting club, like go and be involved in a sporting club. If you want to really develop your manual skills, seek out people or courses or whatever it is that allow you to practice that in a systematic fashion.
Yeah. Part of that too is understanding the the narrative and how we're taught to think as well. Like I was speaking to a
Mm,
colleague of ours recently who works at a university who was actually talking about how their current course content is very anti-manual therapy. You know, it's that very standard thing you hear with physiotherapists in Australia of there's no evidence for manual therapy. And so there's very little manual therapy skill development in their curriculum. They're starting to change that because all the graduate students are coming back to them who work in private practice saying, oh, wait, we actually use a lot of manual therapy in private practice with really good
mm,
effect. We really wish you taught us that in much more detail and teach it in a way that's effective, where ultimately you're spending some time each week going over your hands-on assessment and hands-on treatment to develop the fine motor skills to be able to feel some of the tissue characteristics and quality that give you indications of abnormalities or changes that you can potentially implement with manual therapy. And look, to their credit, I know this university is looking at making changes, but it really highlights a couple of things to me that there is such a strong narrative and education system that doesn't advocate for that. But there's also that real
do you think
disconnect.
that that's a cultural thing? Like, do you think that that's an Australian thing? Like, one of the questions that I've been thinking of, and I've been thinking about it a lot because I've traveled to a fair few countries so far,
Mm,
is the cultural differences, and they are stark. Um, I know I'm changing topics slightly, so finish off what
no,
you were saying if you want to, but do you see a really big difference between the approach, not in terms of the physio, but just the way they approach problems, their learning between different therapists from different countries?
yeah,
And
absolutely.
maybe what are some of those observations that you've seen?
Well, look, it's been one of the interesting things with doing this course because there's 40 of us, about 30 of them are from Europe. There's a bunch from the States, a couple from South America, a couple from Africa. All the people from Europe are well, there's a mixture of physios, there's some docs, there's some chiros, but particularly for the physios, chiros, they're very manual therapy focused. And in fact, it's probably one of the things I noticed with them is their understanding or application of exercise is probably a little bit less than, say, what we focus on here, but you certainly notice that difference. And interestingly, I find that they pick up certain skills better than say I do because I wouldn't say manual therapy is a something that I certainly engage and utilize it a lot more now. But I certainly think that's a skill set and a part of my brain I actually haven't developed a lot because it hasn't been something that's been advocated in our profession. And because of the fact that it's a somewhat of a subjective skill, you actually need the guidance of an experienced clinician to help explain and understand what it is that you're doing and feeling. Because again, you can read about it all you want, but it's another thing to go, what is that I'm actually feeling? Like, is there a change in tissue tone? Is there a change in tissue sliding? What does it feel like to feel certain type of muscle mass or sort of muscle phenotype based on that person's training history? Like these are things that you learn through the guidance of other people. Like I know, for instance, when we started working together, because of your experience and exposure to athletes, and because obviously you do a lot of you do manual therapy a lot working in sports, you start to learn about some of the specific adaptations that happen in those really elastic profiles. That's something that
Hmm.
we didn't learn about at university. It's something I actually didn't even heard of, let alone think about what kind of characteristics that starts to develop and that you can feel through your hands-on assessment. So that's something that I've really paid attention to with regards to differences in different parts of the world. It's interesting to note too, like I know with this particular with their fam, it's really big in Europe, particularly in Poland. And it's interesting asking, like, why is it gotten really big in Poland in particular? And it's interesting. One of the reasons is in Poland, I think all physiotherapy is you have to pay privately, and there's quite a lot of physiotherapists. and so there's a lot of competition. And so certain Polish physios have obviously been exposed to FM, have seen clinical value in it. And I think also too, the reality is most people when they come to see you in a clinic,
They
their
want to be, yeah,
expectations
hands-on.
are to have some hands-on treatment. And so the people who have done FM have obviously had some really good success, and it's caused like a big push for a lot of other physios in Poland to actually learn
Do
this
the
to
same.
be able
Yeah.
to even the playing field, so to speak. But I
Yeah,
even
it's
think
an
about that
interesting one.
too. Yeah, I even think about that too, even within Australia, because you certainly see that real divide between older and younger clinicians with regards to how much interest or focus they have on manual therapy. Like I think of the physios who are, 20 years older than us, they're very manual therapy focused, as opposed to our age group and younger, where it's very much been moving away from hands-on. Like even when I think of say like postgraduate qualifications where there used to be a postgraduate in manipulative musculoskeletal therapy, and it
Hmm.
doesn't even exist now.
The in a more broad sense, have you noticed the difference between the curiosity and the learning of different populations or different ethnicities? Do they approach things in different ways? And it's not necessarily related to, healthcare, but like actually how they look at the world and the way that they try and consume
Mm.
information. Is there differences that you've noticed? Because they're the cool, peculiar. I'll explain some of what I'm talking about when we talk about
Yeah,
just general observations, but I thought maybe you were seeing some of that from a learning perspective.
look, I definitely have, and it's something that I think I need to explore further to actually understand some of the certain cultural characteristics of people from different countries. Because the reality is, I probably just don't have enough exposure to people doing the course and understanding their cultural background. But you start to make certain observations where there seems to be a strong association with how people, it's almost like a philosophical association between people's perception of the world and their willingness to be open to new or complex concepts. And I
Yeah,
like I guess the obvious example of this is I think of say like Chinese or Eastern medicine. I have a colleague who you've met before. She's a physio, a Chinese Malaysian background, grew up very much with Eastern Chinese medicine philosophy. And her clinical perception and framework is very much embedded in a very different model to what we learn from that sort of very, like I know we're sort of taught the biopsychosocial model, but being very much like get the diagnosis, here's the protocol. Where
yeah,
she's very much of like
pathanatomical, yeah.
totally, where it's, it, people will be certainly critical of this concept, but like that very holistic model of where are the imbalances? How do I address those imbalances?
Yeah,
And I don't really know enough about different European cultures to do that, but I think of again FM is really big in Italy, but I mean
that's
saying
where
that
it's
that's
from,
where it
obviously. Yeah.
started. Yeah, it's really big in Poland. Interestingly, it's getting pretty big in the States, which is an interesting finding considering that you probably associate the
Like on that,
States.
and as I said, I think the United States is an interesting one. I've done a fair bit of travel there, as you know. And I think
Mm,
one of the things that the United States is actually really good at is they are very open to new information because they seem to be always looking for the latest and greatest. Now, that gets them
yeah,
into
sure.
trouble because they often will try things and do things that don't maybe have the evidence behind them. And like for instance, it's always interesting talking to American clinicians, doctors, whatever it is about PRP.
Mm,
Not all of them, but some of them swear by it as if it's gospel. And it
mm,
doesn't matter how many studies you show them about PRP, they don't seem to actually want to change their position on it.
mm.
Um, and they use really weird metrics like, 4,000 happy customers, I've applied
Yeah.
PRP to, and it's like, okay, fair enough. But
Well, you and I actually had this conversation recently because I remember sharing, I listened to this podcast of this guy who is got a business in healthcare, developing a new healthcare model in America, where basically the model is they scan you once a year, and it's basically about finding pathology and treating it early before you're symptomatic. Now, there's obviously problems associated with that because, as we know, just because you find
screening
pathology,
has
it
issues.
doesn't
Yeah.
totally. But interestingly, I also remember him talking about how we're going to have a revolutions in healthcare where you're going to basically be able to cure things like osteoarthritis, cardiovascular disease. And he was talking about a particular new molecular pathway that they've found and explored in cartilage regeneration and how that they can upregulate it. I can't think of the name of the particular pathway. And I remember talking to you about it, and you said this very thing. And it's interesting because we've seen time and again people attach themselves to one particular, molecular or cellular pathway, going, "This is the key," only to find out there's a lot more complexity to it. And so I think that really sort of highlights some of the belief systems you often see in the states.
Yeah, as I said, like traveling around, I've noticed that there are, and it's obviously these are generalizations, and I'm sure it doesn't apply to everybody, but the way in
Sure.
which they see the world, as you said, is very heavily tied to their cultural, um, influences that a lot of these countries potentially are thousands and thousands of years old. And I think in
Mm.
Australia, we don't necessarily get some of that because we don't bring those same cultural influences over such a long period of time, unless you're obviously from an indigenous background. But that in itself is not necessarily as obvious because we don't have as many of the population being indigenous. So it's a really interesting observation when you see, like, for instance, obviously at the moment I'm in Italy, and I find Italy a very strange place. Like, I think they still, I say this with respect, but they seem to still be patting themselves on the back for the Roman Empire, um, which, given it's thousands of years ago, I kind of feel like they need to move on a little bit. Um, and then you go to places like, I was in Norway last week,
Mm.
and I find, as much as, Norway's a beautiful place, but culturally, they're hard people. They're
Mm.
difficult to communicate with, and they have an air of superiority. Even though when you speak to them individually, they're very polite, they will kind of like just push into you in the street because it's like you're in their way, which I found really interesting. And I think that these cultural things seem to pervade into how people learn and how they actually apply things. Like, I'm not surprised, as you said, that something like in Italy, it's obviously very highly adopted. And in my mind, the first thought that I have when you say that is, of course, because it was invented there or it's been researched there, they would
Yeah,
claim it
yeah.
as like, this is ours and we're the greatest because we were the ones that, created this information through research.
Mm.
Therefore, this information is absolute gold and it should never be questioned.
Mm. And look, I mean, part of that is also just some of the language barriers too, because the reality is it's been predominantly taught by Italians who some of them don't speak any other language. But a question I was going to ask you, with going through this experience is, how does that make you reflect on the some of the cultural influences in Australia and how you think that influences healthcare or what we do clinically and what we focus on?
I think it's very much, a particular Australia there is an issue because we're in a bubble.
Mm.
Um, and the isolation it creates a really weird, I think it creates a really weird culture in Australia. We have a level of arrogance academically in Australia that I don't necessarily think is warranted. We are obviously a very highly educated nation. Um, I think we're one of the highest in the world in terms of like tertiary education rates, but I don't necessarily think that allows us to take the stance that we should, or that we do. And then the biggest thing that's very, very obvious, and it depends on where you go, like that's probably the thing I notice most about traveling in Australia versus traveling in America, is how bad we are with tall poppy syndrome.
Hmm.
In America, if you're exploring something or you've got an idea, even if it's not proven yet, they will support you and say, "Oh, like that's really cool. What else do you think you need to look at? How do you explore that? All those kind of things." Whereas in Australia, they
Mm.
go, "Oh, that won't work. Oh,
Mm.
that's a silly idea. Have you thought
Mm.
of this?" The evidence doesn't support that. So I think that there's a really interesting thing there. And I don't, not that I understand it or what comes into developing that mentality. But I think it's a really dangerous thing. I think we have a quite a toxic culture around, um, you know, people being way too dismissive of new information at times. And I'm sure you've probably felt that firsthand when it comes to fashion manipulation. They haven't heard about it, so therefore it's bullshit. And you're like, maybe you should look at it first, and then you can decide whether you like respect the information that's been developed over a really long period of time.
Well, look, I was going to actually just share an experience I had earlier today where I was doing a
Today,
present today. I was doing a presentation to a clinic on some of the stuff and work that we do clinically. And putting aside fascial manipulation, I wasn't even talking about that. I was just talking about fascial physiology and pathophysiology. And the clinic owner just stopped and said, "Man, I have never heard of this stuff before." And like, and we ended up going down a conversation of going, "Yeah, look, honestly, I putting aside FM, I wasn't even talking about that particular method. We were just talking about fascial research, which is certainly
yeah, it's
not."
just anatomical research, basically.
This is not controversial stuff. This is abundance of research that's out there. It's essentially been completely dismissed and ignored in Australia. You know, like, I mean, there are some people talking about it, but a lot of clinicians, for them, they may have heard of fascia. They might think of, the thoracolumbar fascia or maybe the iliotibial band. They really don't know very much about its anatomy, its physiology, its biomechanics, let alone thinking then about how it then applies to a lot of clinical presentations, particularly in understanding pain and chronic pain. Um, and that itself sort of, I think, to me, highlights some of the limitations we have where the adoption of new knowledge or perspective seems to be, like you mentioned, there is apprehension towards that. I think there's a lot of people who we have a particular model, and we can even think about what that model is. When you think about physiotherapy and what physiotherapists talk about in Australia, it's often very much reduced to a few couple of things of like this idea of motor control and what that is, and often that's oversimplified and
Yeah.
how we actually address
And
that.
that's, well, I think that again, that's come from the Paul Hodges Gwenjal kind of tree of research and information. So people seem to kind of navigate towards that. Then there's
Which is
obviously the,
interestingly not reflective of their larger body of research too, particularly Paul Hodges, who have talked a lot about. There's certainly been a massive expansion, and interestingly, his research is now going into fascia itself. But we seem to be very much tied to certain ideas that have been very pervasive within our profession for probably the last 10 to 20 years. Um, it was actually interesting. Speaking of conversations, I was having a conversation this morning with an orthopedic surgeon, and I was asking her about her opinions about what should conservative management look like. Like, if you refer someone, a patient who you think doesn't need surgery, or who has had surgery and needs to get post surgical rehab, like, what are your expectations for what they do? Because I'm always interested to hear different perspectives about should that actually look like. And it was interesting because initially, I think that she said a lot of the things that you would typically think of, like, rice and getting the swelling down and all that kind of stuff. And I said, no, no, look, to be fair, I think actually most physios very much understand that stuff and probably address that early on. But I'm talking about getting someone from where they are to where they need to get to. If you've got someone who, whatever it is, they rupture their ACL and they've either had surgery or perhaps they haven't had surgery because they're not going back to change of direction sports. What are your expectations for where they should go? Because that in itself is so arbitrary. When you read research and you look at conservative management, I often ask myself, well, what actually is that in itself? Because, I mean, you could have literally
it's
hundreds
broad.
of different, yeah, exactly, hundreds of different expectations or beliefs about what that is, about what people focus on. And um, yeah, it was something that was really stood out to me because, and she was really good about it. Of like, well, are we actually doing what we should be doing to make sure that someone actually gets back, or basically has the best opportunity to have the best outcome from a conservative management or post
Mm.
surgical in terms of
We're not.
rehabilitation?
We're not. Like I think that's what varies so much, and that's why. if you look at the ACL research, I think that that's one of the big things. It's one of the big confounding variables when they say, this percentage of people do not get back to the same level of activity. It's like,
Yeah.
well, what did they do? Because you've got 9 to 12 to 15 to 18 months.
Mm,
And we know firsthand, having dealt with people who've been part of what we do or have come from other environments previously, the type of rehabilitation that they're doing may be very different. We probably tend to be much more on the higher and more aggressive end.
mm.
And sometimes that's good and sometimes that's not. But there are people who, and this is a very generic statement, so I understand, but you see it quite often on social media where someone will say, "Oh, this is end stage rehab for ACL," and
Mm,
someone's doing like lunges, and you're
mm.
like, "That's not end stage. That's nowhere near matching the biomechanical or ergonomic requirements of the activity that they're potentially going back to." If the only thing you've done is some lunges, even or despite how quick you might be doing them, and you go back to a change of direction sport, you're not prepared for the stresses of that sport.
Yeah, and look, the big part of that then is actually exposing yourself to understand what are different exercise modalities and how do you configure those modalities to implement certain changes and adaptations. And interestingly, it's quite different to, again, like a surgeon. You know, if you are an orthopedic surgeon who specializes in knees, you're going to really refine what you do. You know that when you reconstruct someone's ACL, you're going to be using a patella tendon graft or a hamstring graft, most likely, and you refine it to know exactly what to do so that you can have a very consistent outcome and expectation. When it comes to something like conservative management, that becomes so broad. And we see that when it comes to what people do, because the reality is some people might just focus on doing clinical Pilates. Some people might just focus on doing body weight exercises. Some people might just focus on doing heavy resistance training. Now, the reality is all of those interventions probably play a role in someone's conservative management and the success that they have in addition to others. But that comes back to, do you feel like you have enough understanding exposure to, say, the force velocity spectrum, or understanding running mechanics, or understanding programming and periodization, so you can actually implement all those things to create ultimately the best conservative management plan for that individual, and understanding that the reality is you're going to have very different programs and interventions for different patients. I mean, there's going to be similarities, of course, but that also, I think, becomes difficult because, as we've talked about a lot before, both, in our personal time, but even on here, that can be a very hard thing to explain to patients as well. It's actually
Mm,
very easy to explain to a patient, I'm going to reconstruct your knee and this is exactly what I'm going to do. Or
yeah,
if all you do is, manual therapy and all you do is massage, it's like, all I'm going to do is massage and this is exactly what we're going to do and what's going to look like. It's very
yeah.
hard to go, well, okay, you've probably got a 3 month, 6 month, 12-month process. Let's actually sit down and talk about what that looks like, because you have to understand that this is going to be a long process. It's going to require progression. It's going to require you pushing yourself. That's a very hard thing for people to understand and grasp. And um, like, again, interesting talking about the experience I had today with doing the presentation to the clinic about the framework we use, which is quite a broad, what I would say, very you know complete or holistic method. Is like, how do you apply that clinically? Because there are so many potential modulators that we might look at to address someone's problem and get the best outcome, but how does that actually structured over time? And, like, I sort of talked about how we go about doing that, but that in itself becomes something that's difficult for people to sell and for people to understand, because it's a process of implementing, assessing and implementing different systems or different parts of someone's musculoskeletal system so that they ultimately
Here's a
get the best
question for
outcome.
you. Do you think that that's getting harder now that people have more access to information and there's this perception, excuse me, there's this perception that people understand particularly healthcare to a greater extent than maybe they do, and this will sound mean, but they're less willing to actually listen to practitioners or experts.
Well, and look, I think the other thing with that is people's attention span too, because the reality is,
Mm,
we are used to sound bites, and so to sit down and for someone to actually explain something, um, that becomes difficult because people have an expectation and have typically like simplified messages. And yeah, look, in short, I do think it's a challenge. I don't deny that for a second. But it's certainly interesting to see the differences that we have clinically in outcomes with patients for the ones who do understand the process and requirement of what it takes and the timeline for that.
mm,
This is again the difference between, oh yeah, I feel fine now, versus, okay, I feel fine, but I'm actually now more anti-fragile. Like, I have the capacity to be able to mitigate future injury exacerbations, in addition to actually having knowledge to be able to understand what is required of me to do on a regular basis to maintain my current capacity.
and do you think that that's at the moment that's an age thing? You know, it's like generational. Do you think it's cultural? Like, what do you think is,
Mm,
even just from your observations? I don't know. We don't have answers, but we're kind of
mm.
postulating what could be influencing that.
Yeah. Look, I think it's probably all of the above. And ultimately, I think it's also about expectations too, because the reality is people come in, people who come in clinically have very specific expectations of what they want, and that can vary. That can vary from, I want pain relief, and that's the only thing I'm interested in, to I want to develop self-management strategies, to I want to have a clear understanding of the diagnosis, and the list goes on. So, um, that in itself can be part of the challenge to understand, well, what are people's expectations? Because you need to make sure that you align with that and address that, because otherwise, your ability to have good outcomes is going to be limited.
Hmm.
Yeah.
Yeah.
I was going to actually ask you, John. We've been talking a lot about my experiences, and you've obviously talked a bit about your experiences of just understanding or observing more broadly some cultural differences. But I'd be interested to hear some of the things that you're going through and learning about from coaching and with some of the athletes and their performance over there.
Oh, I think like there's lots of different things. Obviously, this is the second or third time that I've done a major trip or a more extended trip in different countries, and it's always very obvious that there are very big differences with the way in which people approach things. Um, and I think, as I said earlier, like I don't know that there's any other way than being in that environment to pick up that information.
Mm,
The good thing is success leaves clues, and there's a lot of commonalities to what the best people do. They might approach it in a slightly different way, but there are a lot of commonalities. You know, the way in which they move, the way in which they try to, create sort of patterns, the way in which they kind of do things seems to be very, very similar. You don't tend to see a lot of people doing extremely different things, even though on the surface they might appear that they are not the same. Once you boil it down, they tend to be quite similar, which is kind of nice because you start going, well, maybe we're on the right path.
mm.
Um, the thing that I find interesting is observing. One of the things that I find the most interesting actually is observing the level of specificity that certain people use and the lack of specificity that others use. And I don't know that I have and even an outcome that I take from that. But other than, like some people seem to be able to get away with using a much more sort of generic approach to things, and others are so sort of pedantic and finicky about what they're doing. Um, and,
Well,
and, and that to me is interesting because it's like success seems to happen on both ends of the scale.
well, I was going to ask, like, when you, just to be more specific, like, where are you observing this? Are you observing this on the, like, the warm up track and their process
Yeah,
and
yeah. So,
routine? And
so, so you look at like some athletes, right? And maybe this is a talent thing, who knows? Like maybe the
mm,
ones who are super talented can get away with being less specific. But, there's some where, and these are some of the best athletes in the world, their coach is watching, but they're not intervening every two
engaged.
seconds in everything.
Yeah.
No, they're engaged. I'm not, by no means is it an assessment of whether they're engaged. They might be assessing things at a really high level, but the number
Yeah,
of
sorry, but
interactions they're
engage with
having,
with the athlete. Yeah.
the number of interactions they're having, the way in which they make modifications, the amount of setup that they're doing. Like some are really, really, really specific. They're, putting markings on the track, they're putting takedown, they're putting movements, they're
Mm,
watching like footfalls, and they're talking to the athlete every single time they do an activity. Oh, I want
mm,
you to do this. I want you to try that. You've got to be a little bit more like this on this one. You've got to, increase this or whatever it is. And then, like I observed one of the best athletes in the world and their coach. And when I say one of the best, like I mean genuinely one of the best. And the coach literally stood there and watched and just kind of like, nodded or shook their head a couple of times. And then the athlete went out and ran like, one of the fastest times of the year and all this kind of like, it was really, really interesting because it probably shows two things. One is obviously, and I don't think that this coach is not technical. I think they're very technical, but I think obviously a lot of the work has been done before.
mm,
So the athlete's understanding of what happens, say, in that environment is really clear. They're not trying to necessarily make significant changes at that point. It's more about just sort of priming the system for that competition. And it probably speaks a lot to the level of understanding that both the athlete and coach have of each other, that the communication doesn't need to be over the top. Um, and I think that those are some of the things that are really interesting to observe is, I remember a coach once telling me, the more a coach talks to an athlete, it usually shows how the insecurity of the coach.
mm,
They want to convey information, they want to get across things, and it shows that, maybe they don't necessarily, and not in a at a personal level, but they don't necessarily trust that the athlete is understanding what they're doing or is, getting that information in whatever way. And maybe that's going to be like you always hear of some of the top coaches talking about when they start out with an athlete, the amount of communication is really high. And then over time, they wean that down so that they don't
mm.
need to be talking all the time. Because, as coaches, I think we love the sound of our own voice at times. And I think it's really interesting to observe that. Um, it's actually just really cool too to be in the environment with some of the top athletes and see the kind of stuff that they do focus on.
Well, before we jump to that, I wanted to, talking about that idea of like self auto regulation or autonomy versus control. I think it applies to clinicians too, because we've talked about this before. You see some clinicians who literally, from the first time they're getting someone to squat, they're telling them exactly where their knee should be and their foot and all this stuff, and don't give them any opportunity. But at the same time, and I'm probably someone who leans towards giving people more autonomy and flexibility
Mm.
with learning over time. But do you think there is a right or wrong with that? Like you talk about these different observations of certain athletes and their coaches. Do you necessarily see one better than the other, or do you think that it really has to depend on the individual athlete and how they actually respond and the relationship that they have with the coach?
I think it's very individual, but I do think that you're not going to get, and this is not from me, but this is, well, I guess this is probably somewhat from me in some respects. As time goes on, it's one of the observations that I'm making is the athletes, even the ones that I coach, the ones that do better are the ones that become more and more self-reliant,
Mm,
right? Where they know you're there and they know that you're observing and they know that they can ask you for help, but they're not asking for it unnecessarily.
mm,
The ones who are coming and asking a lot of questions consistently and they're asking for you to intervene in things that they have the ability to make decisions about shows that they're not willing to take up that ownership of that. And that can, in a harsh way, that can actually be a really poor reflection on their ability to take up ownership about their performance as well.
mm, mm.
Um,
Well, the first thing I think of in that situation, just from observing you with your athletes, is development and success doesn't happen in a linear fashion. So the
no.
reality is, so much of the success of an athlete over time is more how they actually can cope and deal with the crap times, the bad times,
Mm.
because inevitably they're bound to happen, whether it's related to just performance not being there or injury.
It's interesting actually watching that. That was that's like been the really big observation as well. Watching athletes how their competition goes and their emotional regulation, post.
Mm,
Um, it's really interesting to see the ups and downs of even athletes who are at, the top of the top.
mm,
Um, it was very interesting watching. There's, a couple of athletes that I saw that I don't know them, but you know who they are because obviously they're quite, well known. But like you see them on the track, you see them get their performance probably wasn't what they wanted based on season's best or PBs or whatever, and place in the race. And then, you see them, there was one guy, for instance, who ran in the 200 meters. And from all of the observations from afar, he seems like a really good guy. He posts things online and he's very interactive. He seems like a really, just a nice person generally. And he clearly didn't run as well as probably what he wanted. And then after the race, I see him literally sitting on his own in the dining room, looking like his cat died. Um, it was just really interesting because like I'm in two minds about some of this stuff as well. Of like, how much value does getting upset and I'm not going to say putting on a show, but basically like going through this process of pretending like it was the worst thing that ever happened because you didn't run well. Um, and is that even beneficial? Like, do you need to be upset about it, or do you just need to act on the information that means like, okay, I've got to change these things and then go to the next race?
It's funny you say this because I've looked into trying to find research to see, does stress enhance or reduce neuroplasticity, the ability to adapt.
And
And
you mean
with a
like
couple,
emotional stress, or are you talking about
no,
like,
I'm talking emotional stress because it
yeah,
seems to me like when you think about it from an evolutionary standpoint, when you experience negative emotions because you have an unexpected outcome, ideally, and I guess it probably varies based on how you perceive it, you would hope that it actually enhances neuroplasticity
hmm,
and the ability to adapt because ultimately that's what's going to lead to a better successful outcome next time. And that makes sense when you think about again through evolution, like the process of hunting or foraging. If you fail to have a hunt, you get hungry and you're like, I need to make sure I get a catch
yeah,
next time. But interestingly, a couple of things I came across was there was not a lot of research about it, and it seemed to be mixed because a lot of it I think was more related to chronic stress, and that's showing a reduction in motor learning capacity.
yeah, versus like
Um,
more of an acute episode.
Exactly. So it seemed very inconclusive from what I've seen because that's something I often think about, and we've talked about this concept of hormesis, of applying an appropriate stressor to allow effective adaptation to occur. And typically that happens in a process where that primary response may not always be positive. And I often think, can that also be associated with a negative emotional state because of an unexpected or undesired outcome? That if perceived appropriately allows you to achieve or upregulate yourself in a way that leads to better outcomes in the future, whether that's due to a cognitive or a physical pursuit.
Yeah. Yeah,
Mm,
I think that's interesting. But like as I said, I don't know whether some of it's almost like a bit of a show. It's
mm.
like, oh, I didn't run that well, so I need to pretend like I'm upset. Um,
So you're not sure if this person actually genuinely was upset.
no, no, I think they were. But what I'm saying is exactly what you mentioned. Like, is there any value in that? And if there's not,
Mm,
would you be willing to let it go?
mm,
Because if the thing that you're most committed to is better performance, like I think people do it because their perception is that if they show that they're emotionally attached to it, then that
mm.
means that they're going to get a better outcome in the future. Like I really care about this, therefore I will act on it. But
Yeah.
if as you mentioned, that's actually detrimental. Like you're going to learn less by having this emotional experience of being upset or sad or whatever, is that actually useful? Like, if you find out, well, actually, that reduces my ability to work on this task the next time, are you better off just
Mm.
abandoning that and then being like, oh, well, that wasn't a good race. These are the things I did poorly. These are the things I did well. I'm going to enhance the ones I did well and try and reduce the ones I did poorly. Like, move on. Can you
Yeah.
can you develop that?
Well, actually, I think you're really highlighting there too, and because it is clear with chronic stress, it's not beneficial that if you are fixated on a negative outcome for perhaps more than, I don't know, what would be acceptable, half
ten
an
minutes.
hour? Yeah,
Yeah.
exactly. You're actually going to see worse outcomes. You know, if you're the kind of person who's holding on to that and you're thinking about it and ruminating consistently, then, well, we know those issues where you start to get reductions in sleep that obviously affects cognitive performance and physical performance, and you get that negative cycle. So yeah, I think you raise a good point of it's probably something that you can't hold on to for too long.
Well, I think it's interesting because it's like, are you, what are you committed to? You know,
Mm.
are you committed to getting better? You
Mm.
know, and I think this comes to our learning. We spoke about, you know, manual therapy or whatever it is in a healthcare task. Like, are you committed to getting better, or are you committed to the perception of getting better?
Mm.
You know, or perception of caring? Because if all you care about is the perception, then maybe you make a big song and dance about how you studied something or you got upset because you didn't run well, versus, you know, the moment that you come off the track or the moment you have an outcome with the patient, first thing you do is not get upset and wallow in it, is you pull out a book or you contact a colleague and say, I need you to show me this because I actually didn't get
Mm.
this right. Or,
Mm.
you know, you're on the phone with your coach or you're looking at video going like, oh, I actually did this. I need to look at it like that. You know,
Yeah.
like that shows me in my, from my perspective as a coach, like I'm much more interested in the athlete who wants to know what they can do better
Mm.
and is not really that attached to what the emotional side of the outcome was, because that shows me they're actually more committed to the outcome than they are committed to the perception that they care.
Yeah. Well, it's that thing that you hear a lot of successful people talk about, like that abundance mindset, where like the reality is whatever you pursue, there's always going to be negative experiences along the way, but actually that has little effect on that person who only sees the ability for growth and that growth to be potentially exponential and potentially infinite, actually, when you think about what is capable. So um, you don't get brought down by any of those negative experiences along the way.
Hmm.
Mm.
Alrighty. Is there anything else that you wanted to touch on, Joe?
No, I think I've gone through all the things I've been considering. You, John?
Yeah, we'll try and do this obviously again, maybe in a couple of weeks, while I'm away. We'll sort of maybe even do a recap on some of the comps and things like that. Hopefully, we get some more good results and can talk about some of those, because I know people seem to be interested in that, even though I find that sometimes the least interesting part of the whole thing.
Well, actually, you have had some athletes compete already. Yes.
Yeah,
Yep. Good
yeah, they've
results.
done it. Yeah, moderate. They've had two competitions, some seasons best, so
Okay.
that's reasonable. You know, the one that was exciting is that the three of the girls got to run in a relay at the Diamond League in Lausanne in
Mm.
Switzerland, which was kind of exciting. You know, our changes were terrible because we didn't really practice much, and um, you know, one of our runners made a big mistake and ran off early, so didn't even finish. But um, I think the experience in itself was pretty valuable to the girls, in the sense that, you know, they're running in front of 40,000 people, I think it was.
Mm.
You know, it was so much so that Mia passing to Jessie, the change was terrible because Jessie actually couldn't hear Mia calling, you know, her to put her hand up for the pass. That's how loud it was, which is, you know, which is an experience in itself. And I think
Yeah.
the good thing about being exposed to that, and I think that that's one of the things that, you know, I noticed about when we went to the Olympics, and you know, Mia also got the chance to go to the Commonwealth Games, and it was very similar in terms of the noise. Obviously, the Olympics there was no crowd, so it wasn't that noisy. But um, you know, at this, these are experiences that these athletes, I think, need to have, and that's why I think I'm very much a very big advocate for people going out and searching in the world and looking for opportunities. You know, we're very, very fortunate and lucky and grateful to get some of the opportunities we had. You know, they come across sometimes fortunately, sometimes it is one of those things of, you know, you're in the right place at the right time. But the big thing that I think it demonstrates, and it's really important to do, is you can't buy experience, as we said. So if you're going into a major championships and you've never experienced a crowd where you can't hear yourself,
Mm,
when you're screaming, then you need to actually start to understand how that's going to play out in a major championships environment. You can't be in this state where you think it's going to be like a local competition in Australia or at home where everything is done for you.
mm,
And one of the mentor coaches that I had said, like one of the big things athletes sometimes have this perception of is they think that when they get on a plane, they get faster. And he's like, this doesn't work like that.
mm,
You need to put yourself in that environment to get those experiences, to understand that it's not easy. And there are difficulties associated with it. Like, I think obviously two of the athletes that I have with me have traveled before, two haven't. Doing sort of they call it, like the sausage circuit around Europe. And there's lots of travel. There's lots of travel days. It's long travel. You're on buses and trains and flights and all sorts of stuff. And I think that in itself is really valuable because you start to recognize, okay, you know, it doesn't need to be perfect for me to be able to perform at a high level. And in fact, I need to
mm,
get the skills to be able to do that in order to actually get to international level. Like, I think this is really interesting. I was talking to one of the agents, an Australian guy, about this of like how a lot of people in Australia seem to have this issue. And I know that, and I'm saying this, pointing the finger at myself as a coach and my athletes is, you go through this process where you try and make everything really controlled and really like, you're very detailed and very like specific about everything. Like, okay, we're going to do this, we're going to travel on this day, and we're going to get here at this time, we're going to do this, and then this happens, and it's all perfect. And then as you go up in levels of performance, you start getting invited to competitions and you can't control those things. It's like, no, you've got to be here and do this. And the only way to get there is to fly to buttfuck nowhere
mm,
and
mm,
get on a bus for 10 hours and then fucking come through here. And then you've got 4 hours of, you know, waiting around. And then you get to sleep at midnight. And then you're like, all right, you got to race at 12 o'clock the next day.
mm.
Like, and it's not ideal by any means, but that's part of being on the circuit. Like a lot of them were in Lausanne, and a lot of them flew straight from Lausanne to Stockholm. Um, and well, we were grateful because we were catching the train, but most of the flights out of Geneva Airport, which is near Lausanne, is was on strike. So about 100 flights got cancelled, and everyone was just like, "Oh, well, like was going to have to find another." A lot of them had to like go to Zurich and then fly from Zurich rather than Geneva. And it's like you just got to roll with it. It can't be this
Yeah.
thing of like everything is so heavily controlled.
Yeah, like I often think about that of, like they use that example of like the cook versus the chef of like there's like the chef, sorry, is it the cook and the chef? I can't remember the
Yeah, to cook
exact
and the chef. The
analogy.
cook follows the
Yeah.
recipe.
Yes. It's like very methodical. We know what the outcome's going to be. The chef will just go like, well, let's do this. Let's add a bit of that. The reality is the chef will have bigger mistakes, but they actually learn and understand the process. And so each time they're like, oh no, we need to add a bit more of this, a little bit less of that, as opposed to the cook who's always required on keeping everything quite constrained and controlled. There's probably
Hmm.
something really to be said, particularly when it comes to high performance, of actually just going through those experiences where you feel
Well,
shit, you don't have a good outcome,
it's
but you
it's
actually
very
learn.
interesting. It's very interesting because I feel like there's a little bit of a slant, even in top of track and field, looking at and observing, but also in high performance, particularly with the data of people getting way too caught up in the real specifics
Mm,
and not understanding that in those environments that are so open, you don't have as much control as what you think. So
mm,
you've got to have the ability to give skills to athletes that lets them navigate the problem and solve and create solutions to motor problems in real time,
yeah,
not necessarily think that you're going to be able to coordinate or orchestrate this specific, really heavily rehearsed, sequence of events. And I
yeah,
think there seems to be this idea that we think because we have more data and we can measure more things, that all of a sudden we have more control. And I think that that's an illusion of control.
yeah. I imagine that also starts to develop some of the psychological traits you need to be able to deal with adversity, where you actually, similar to what we were talking about before, when you have an unexpected outcome, you're not ruminating on it, you're not holding on it, you just move on from it, because ultimately there is no benefit to you thinking about what didn't happen and then thinking about trying to control everything in the future, because the reality is
Mm,
you're always going to have unexpected events or outcomes.
mm.
Yeah.
Alrighty, thank you so much for joining us. We hope that this sort of more broad discussion was interesting. If you ever have questions, always feel free to reach out. Um, we will, as I said, we'll probably try and get this out sooner than maybe some of the episodes we usually do in advance. And we'll try and do something similar in a few weeks so we can update everyone on how things are going.
Thank you, Sean.